What makes LPID, I think, unique is that we are a multi-specialist practice. We've all trained in the States and are now relocated here in London for good. I am a periodontist, David is the implantologist, and Kimberly is a prosthodontist and restorative dentist, and we also have a couple of hygienists that work with us. I think what makes us unique is that whilst we're different specialists, we've all been trained to have a very good grip on the diagnosis. So when patients come to us, we make a very thorough examination that doesn't just involve our specialty. So for example, when patients come to me, I will be checking their temporomandibular jaw, their joint, to make sure that there's no clicks. I'll check their lymph nodes to make sure that there's no other infections going on. Then we'll move on to an oral cancer screening, checking all the intraoral tissues, making sure that all of those look normal and as expected. And then we'll move on to checking all the rest of the restorations that patient has come with to make sure that they're fit and healthy and they don't have leaking margins, broken teeth or anything like this. I wouldn't be the one to repair those restorations, but I can certainly recommend my colleague Kimberly, who is very good at that. And then I would then move on to check the foundation, which is my little area of periodontal disease. So the foundation of the teeth, all the gums, bone, and roots around the teeth. And at that point, we take x-rays of all of the teeth and do a periodontal charting, and we see if there's inflammation, presence, and bone loss. And that's when we can then make a diagnosis of periodontal disease and prepare a treatment plan. And if that patient has already had missing teeth, then once the periodontal disease is treated and controlled, then obviously I could recommend my colleague David to do some more advanced implant work. If it's fairly, if the bone is correct and so on, I also place implants, but in very severe cases, I send them to David. And so I think the uniqueness is on the diagnosis and the comprehensive treatment plans that we create at LPID, because of the fact that we have all these tools that we can use between us to form a good case and try to restore the patient and take them into their journey into a healthy smile. Because sometimes it's not just one thing that has gone wrong, sometimes it's multiple things. So sometimes a patient might have had periodontal disease, but they also have wear facets because they've been grinding their teeth. Sometimes they have a click, sometimes they've got also a missing tooth because from grinding they cracked the tooth. And so you have to use different specialties to correct the issue, and it's all in-house and very well controlled. We don't lose the control.